السلام عليكم.
عليكم السلام.
وعليكم
عليكم
السلام.
السلام. وعليكم السلام.
وعليكم السلام.
وعليكم السلام. دكتور.
Dr. Ali.
How are you guys? Ramadan Kareem.
Fine,
الله
thank you.
أكبر. Thank you.
Okay, inshallah, today we will practice history taking, which part Socrates. Okay. Again, please, in any online session, even in recorded session, when you are listening to previous session, prepare paper and pen. If you find any note, you can write. If you want to pass with very high score in any exam, depend on many things. Your eyes, your ear, your hand. So if you are listening, if you are seeing anything, you are writing anything, this will optimize your understanding. Okay. So today, history taking Socrates. In the exam, 3 stations, complex stable patient for adult, and 1 pediatric emergency medicine. So total 4 or more for history taking. It could be history, it could be psychiatry or toxicology. Again, to remind you, the most important domain, clinical reasoning decision making, means management plan in all stations, communication skills, your attitude inside the room, and also good listening, good eye contact with the actor, give information in pieces, rapport, empathy, sympathy, check comfortability, pain, like that. Organization, prioritization skills, it should be organized in all stations. We will start by history taking. After we finish like 4 or 5 sessions, we will go for psychiatry, toxicology to 1 session, resuscitation 3 sessions, practical skills teaching 2 or 3 sessions, system and joint examination 2 sessions, communication skills 2 or 3 sessions. And then we will do mock exams. We finished almost 40 batches, online and face-to-face. Regarding the rate, we have the highest rate, we have the highest scores. Now we are doing batches for June and July. We are doing batches for June and July. For people who joined for September or December or next year, 2025, no problem, you can attend as a listener, okay? Here we are doing batches June and July because no time after June. No time after June. That's why you should be active. I'm talking about July batch. You should be active and be ready for the exam, okay? We will do mock exams for June and July after we finish teaching decisions. And once we finish June batch, I'm talking about after the exam of June batch, we will do mock exams again for July batch. Is this clear, guys? This point?
Sir.
Yes, sir.
Okay. Accuracy means the checklist. So we will give you feedback according to the accuracy. So if you mention all the points in the checklist, I mean the general approach, you will get 100% in accuracy. If you are very fluent, and again, please, fluent doesn't mean talkative, no. Sometimes you are silent but fluent, okay? Fluent shows the examiner that you are not recalling, show that you are doing this every day, okay? Supportiveness, so communication skills, efficiency structure, organized, safety, you should cover the safety points. Okay, for example, if they give you pie chart, task, and scenario. So number one, check the pie chart. What is the main domain? Okay. If you find history, so the main domain history. And the task, take history. Okay. And then check the scenario. So the general approach of history, we have introduction. In any station, do introduction. Even you are not familiar with this station, even you don't understand. In the exam, go for introduction with the actors. You will take marks. Okay. Good morning, I'm Dr. Blah blah blah. May I know your name and age, please? You will take marks. Nice to meet you. Smile to him. Nice to meet you. You will take marks. How can I help you? Even you don't know this station, you can say like that. Okay. If he said chest pain or anything, so sorry to hear that. Empathy. No need to move the patient to resus room, but in case of chest pain, heart racing, collapse, dizziness, fits, confusion, any serious complaint, I'm sorry to hear that. I need to move you to resuscitation room, connect you to heart monitor, check your vital signs and the blood sugar to be sure that you are okay. Then check comfortability. Are you comfortable? Do you have any pain? Then take consent. I need to take some data from you. Then no need for nurse. No need. Don't waste the time. Second open question. How many open questions, guys?
3 questions.
Three.
Three questions.
Three.
Yes. The first one, how can I help you? And stop. Let him to talk. The second open question, can you tell me more about that? This is the second open question. And stop. Let him to talk. Anything he will say, you should repeat. So if you did not repeat, okay, um, we will practice now, guys. I will be examiner, and other colleagues will be examiners also. I will give feedback, and your colleagues will give feedback also. Okay. So if someone missed this point, he did not repeat, you should mention that he did not repeat the answer of second open question. Okay. Okay. After that, Socrates or Oediper or who approach. Today we will practice Socrates. Okay. After Socrates, associated symptoms. We have 8 systems. We consider 4 systems. So GIT, urogenital together, dermatology miscellaneous together, and cardiovascular respiratory together, CNS, PNS, and musculoskeletal together. And at any time, uh, it depends on the site. If the site in the abdomen, how can I help you? I have yellow discoloration of the eyes and the skin. So jaundice. Jaundice here, it's relevant to the liver and the liver in the abdomen and the abdomen relevant to GIT and urogenic. So how can I help you? The complaint give you idea about the site. And according to the site, you will start by the system. I have chest pain. Chest pain in the chest. So cardiovascular and respiratory. Okay. How can I help you? I have vision problem. Vision here, eye. Eye in the head. Head, it means CNS and the musculoskeletal and so on. Okay. Then you will go for general approach. We finished. Once you finish associated symptoms, then go for general approach. General approach in history or psychiatry or toxicology is the same. Any previous blah blah blah, any past medical disease, any previous surgery, any blah 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 blah, as we discussed in the introduction. Okay. Then the last open question. After you finish everything, would you like to add anything? After that, the concern. What is your concern? Then mention the diagnosis. Please don't jump to the management without diagnosis. Even you don't know the diagnosis. Okay. It's not logic to say, I will keep you in resuscitation room. Why? You should give him diagnosis. That's why you will keep him in resuscitation or you will discharge him or. Okay. So if the actor say yes, 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 it means for sure you will find diagnosis. If the actor said no, 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 and denied everything, unlikely to find diagnosis. So If you find a clear diagnosis, you can say, according to your data, I'm sorry, it seems like blah, 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 blah. Mention the organ problem. If you find no diagnosis, you can say, according to your data, it seems like it no clear cause, no clear cause, okay? But for this reason, I will keep you in blah, 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 blah. I will do blah, 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 okay? What if the patient needs a discharge? Fix this management in any discharge. I reassure you, uh, your problem is benign and you don't need any intervention at the moment. It's self-limiting, and I will discharge you with printed leaflet. I will discharge you with printed leaflet. Give letter to your GP, discharge letter, and you can return to ER if you have any worrying symptoms. More than it. Okay. Okay. So management, it means the disposition. I will keep you in observation or isolation or resuscitation. I will do examination, some blood test, including blah, blah, blah. Imaging if needed, heart tracing if needed, camera scan if needed. Okay. Until here, clear, guys?
Yes, sir.
Okay.
Yes, sir.
So we have for practice, Nazar, Ikra, Atiq, Safwan, Sima, Hasiba, Randa, Asma, Mona, Kehen, Hadil, Osha, Habib, and Heidi, Tamil, Doyin. Okay, so we will start by Nazar, okay? Of course, Socrates, we discussed the last decision, so don't think about Socrates. Don't show the examiner that you are recalling. So ask him the question directly. Where is the pain? When did the pain start? Sudden or gradual? How would you describe the pain? Like pressure, stabbing, sharp, or tearing? So you should give him example. Don't say, how would you describe the pain? No. How would you describe the pain? Like pressure, stabbing, sharp, or tearing? Does the pain spread elsewhere? Like shoulder, arm, jaw, neck, or back? At any time, the actor will give you answer for the second open question. Don't ask these questions again. You should repeat what he said, but don't ask the questions again. Okay? So if he gave you the pain is central 1 hour ago suddenly and seems like pressure referred to the shoulder, so you can repeat. So you can say, you said the pain is in the center, started 1 hour ago, sudden like pressure and spread to your shoulder, right? He will say yes. Then you can complete the question, okay? You can complete the questions. Is the pain worsening, improving, or the same? Continuous or on and off? Do you have same problem before? Anything cause or worsen it? Anything make it better? And so on. Then you go for associated symptoms. In associated symptoms, no need to ask all questions in details. No need to ask all questions in detail. So you will go for first, second, third, fourth relevant systems in details. You will go for other systems in concise. Okay. So 1, 2, 3, 4, detail. 5, 6, 7, 8, concise. Even you did not ask 5, 6, 7, 8, no problem. No problem because it's least relevant to the complaint. Okay. So in GIT, if you want to ask in details, do you feel sick? Did you throw up? If yes, ask him any blood and also any tummy pain, any yellowish discoloration of your eyes or skin, any change in bowel movement. If yes, any blood in stool. What if you want to concise GIT? One question only. Any change in bowel movement? More than enough. Urogenital, you can ask in concise way. Any change in urine? If he said yes, any blood, and ask about other question. Any change in frequency, any change in color, and so on. If he said no, no need. Dermatology, any skin changes? Miscellaneous. Miscellaneous should be in detail in all stations because that's for malignancy. Any temperature, any night sweats, any lump in your body? Did you lose weight or appetite? Don't ask all questions together, so one by one. Okay. Cardiovascular, chest pain, any heart racing, any dizziness? Okay. Respiratory, any shortness of breath, no wheezes or cough? If you said yes, any blood? If you want to concise, shortness of breath more than enough. If the problem not relevant to respiratory, you can ask any shortness of breath more than enough. CNS, PNS, headache, jerky movements, vision problem, did you lose your consciousness? Musculoskeletal, weakness, numbness, any trauma, more than enough. Odibara, we will practice next session and who approach the following session. Sexual history, no need to ask until they ask you take sexual history or they give you dysuria or urethral discharge. We will practice in following sessions. And the travel history also, no need to ask until you find diarrhea or fever. Pediatric, we will practice later and explain new diagnosis in pediatric, we will practice later. So today we will practice Socrates. Here, throat pain, what is the most relevant system, guys?
GIT.
GIT, respiratory,
GIT and urogenital.
GIT, urogenital, okay. Headache,
CNS and PNS.
CNS,
CNS,
PNS,
musculoskeletal. Musculoskeletal.
musculoskeletal, okay. Chest pain,
CVS.
CVS, respiratory,
respiratory.
CVSRS,
cardiovascular, respiratory, excellent. Abdomen pain,
GIT,
GIT.
GU, urogenital,
yes, excellent. GIT and urogenital. Pelvic,
urogenital and GIT,
excellent. Okay. Testicular pain,
Genitourinary.
genitourinary
GIT.
and GIT,
GIT.
yes, excellent. Back pain
Musculoskeletal.
musculoskeletal,
and
CNS, PNS.
CNS.
yes, musculoskeletal and the same. Of course, knee pain, same, leg pain, same. So back, knee, leg, anything relevant to the bone, anything relevant to joint, anything relevant to muscle, it means musculoskeletal. From the name, musculoskeletal. So bone or muscle or joint. So back pain, knee pain, leg pain, you will go for musculoskeletal and CNS. In leg pain, you will add 4 questions. Any change in size, if you compare with the other limb, any change in size, any change in color, any change in temperature to touch, any change in hair. So 4 questions. Why? Because you want to differentiate, is it artery or vein? Okay? Okay. So here regarding Socrates, we will start by Nazar. Okay, you have 30 seconds. In the exam, you will find 1 minute outside the room and 8 minutes, more than enough. 8 minutes inside the room. Okay, but here for practice, we will give you 30 seconds before the station and 6 minutes inside the station. Okay.
Okay.
Please, guys, mute your mic. Only the one who is practicing, you will unmute. And in feedback, I want your feedback as well. Okay, you can start.
Good morning. I'm Dr. Nazar A&E Registrar. May I confirm your name and your age, please?
Yeah, I'm Karim. I'm 43 years.
Nice to meet you, Mr. Karim. Mr. Karim, I'm here to collect some data from you. Is that okay for you?
Yeah.
Okay. How can I help you today, Mr. Karim?
Yeah, I have pain here, doctor, in my throat.
Oh, I'm so sorry to hear that. Are you comfortable now?
It's okay.
Do you want any painkiller?
The nurse gave me.
Okay. All right. Can you tell me more about your problem, Mr. Karim?
Yeah, the pain started 1 month ago, and I think it's increasing, worsening, continuous. It's increasing if I'm eating or drinking.
Okay, I see. I'm so sorry for that. So you said you had a throat pain. It started a month ago. It's increasing, worsening, and it's continuous, and it's getting worse if you swallow. Am I right?
Yes.
Okay. Is this pain is going anywhere else?
Mm, yeah, in front of my neck.
Okay. Uh, how can you describe the pain? Is it like a pressure, sharp pain,
Seems like sharp, yeah.
sharp pain? Okay. Is there anything make it better for you?
No,
Okay. Have you had similar pain in the past?
no.
If I give you a score from 1 to 10, how you can score this pain?
Like 5?
Like 5. Okay. All right. Do you have any tummy ache?
No, no,
Okay. Did you throw up?
no,
Do you feel sick?
no,
Have you noticed any change of your skin color, like yellowish color?
no,
Okay. Any yellow discoloration in your eyes?
no,
Is there any bowel changes?
no,
Any problem in the urine?
no.
Any problem in your voice?
Yeah, I have a change in my voice.
Okay, I see. So sorry for that. Okay. Do you feel any pain when you swallow?
Yes,
Okay. Do you have any difficulty to swallow, Mr. Karim?
yes.
Is it started by liquid or by solid firstly?
Both.
For both. Okay, all right. Any night sweat?
No, no,
Any temperature?
no.
Any loss of weight?
Yeah, I lost weight, like
How many kilo?
20 kilogram in 6 months.
In 6 months. Okay. Um, Mr. Karim, have you noticed any skin changes? Any rashes?
No,
Okay. Any chest pain?
no,
Any shortness of breath?
no,
Any numbness or pins and needles?
no,
Okay. Any trauma?
no,
Okay. Uh, Mr. Karim, do you have any other medical condition?
no,
Any previous surgery?
no,
Are you in any prescribed medication?
no,
Are you allergic to anything?
no,
Is there any family disease running in your family?
no.
Okay. Mr. Karim, where do you live?
In downtown,
And with whom?
my wife,
What do you do for a living, Mr. Karim?
teacher.
Okay, I see. Mr. Karim, do you smoke?
No,
Do you drink alcohol?
no,
By any chance, do you use any illicit drugs?
no,
Okay. Mr. Karim, would you like to add anything?
no.
Okay. And what's your concern, Mr. Karim?
I'm worried. What is the problem, doctor?
I appreciated your concern, Mr. Karim. According to your data, it seemed the problem in the gland in your neck, which is called thyroid gland, and I need to rule out the malignancy. For that, I need to keep you in observation room. We'll check your vital sign, After that, I need to do general examination. This is include your neck, your eyes, your hand. Then I request blood test for complete blood count for liver function, kidney function, thyroid function as well. We'll do a scan for your neck. It's called jelly scan or it's ultrasound scan to check your gland as well. And then I have to do heart racing, which is called ECG. And after that, we'll wait for the result to come back. According to the result, I can give you the rest of the management. Is that clear for you, Mr. Karim?
So I will stay here or I will go home.
It's depend on the examination and depend on the result of the investigation. If it's all normal, I will discharge you on printed leaflet and you will go for the GP. If I found any abnormality or any problem in your thyroid gland, I have to speak to the relevant specialty, which is will be the endocrinology. Is that clear for you?
Okay, thank you.
Would you like to add anything?
Thank you. Your time done?
Thanks.
Okay, excellent, Nazar. What do you think, guys? How many marks?
10 marks.
10 out of 10.
Are you happy?
9 on 10.
Are you happy with his approach?
Yes.
They had a good approach. Yeah.
Okay. So regarding accuracy, so accuracy, it means the checklist. It means the points. Did he miss any point?
No.
Did he ask
No.
about the site?
No, the site and onset.
No, the site. Yeah, the
Site
site, I
onset,
think,
I think palpitations also, heart racing, he did not ask.
heart racing.
And
Yeah,
feeling
and I think
hot,
the order,
heart regarding if you suspect thyroid.
Okay. So
also the order of miscellaneous and skin, I think
he
went
asked.
the other way around.
Okay, so
Yeah.
regarding the onset, already I mentioned, I said it started 1 month ago, and he repeated that. Okay. Regarding the site, he did not ask. I told him I have pain in my throat. So if I say in my throat, doesn't mean I mention the site. Clear, Nazar?
Yeah, yes.
For example, if I say I have pain in my chest, yes, I mentioned the site in the chest, but where in the chest? In the center, in the right side, in the left side, up or down in my chest, clear? So the pain
Okay.
in throat, where? In the center, up, down, right, left, clear?
Okay.
The where is the pain? In my tummy. It doesn't mean he mentioned the site. Okay? You should ask him where. Can you point at the pain? Okay, site. Okay.
Okay.
So site here, very, very important. You missed this point in Socrates. Okay. The onset already I mentioned, and you repeated that. Well done. So accuracy, I think you covered almost all the points. And maybe 1 or 2 points missed, no problem. Skillfulness, you are very fluent. Okay, so 100% here in skillfulness, 95% in accuracy, 100% in skillfulness. Supportiveness, I think rapport, empathy, sympathy. You show sympathy later. And when I say I have throat pain, you did not say I'm sorry to hear that, but later you said I'm sorry to hear that. Okay. Regarding check comfortability pain, you covered that. You are giving information in pieces, even asking the questions in pieces. You are giving the pauses between questions and between information. So I think your attitude very good. So 100% here in supportiveness. Efficiency structure, very organized. So introduction, first and second open question, and then Socrates, and then associated symptoms, and then general approach. So I think you are very organized. Safety, you cover the safety points. So I will give you 9 out of 10. Okay?
Thank you.
Yeah, perfect. Thank you. Okay, next station, Ikra.
Yes, sir.
How are you?
I'm fine. How are you? Thank you.
Okay, you have 30 seconds and then 6 minutes. You can start.
Hello, good morning. I'm Dr. Ikra, ED Registrar. May I confirm your name and age, please?
Kareem, 43.
Nice to meet you, Mr. Kareem. How can I help you?
I have headache, doctor.
I'm really sorry to hear that. Do you still have pain so I can offer you some painkillers?
No, the nurse give me painkiller.
Are you comfortable?
Yeah, it's okay.
Okay, so I need to take some data, Mr. Kareem, regarding your headache. Would that be okay for you?
Okay.
Okay, so can you tell me more about your headache?
Yeah, the problem started 2 weeks ago and continuous and worsened.
So you have told me this headache started 2 weeks ago and it continues and worsening. Am I right?
Yes,
So where is the site of your pain?
on the right side.
It's only on right side or on the whole of your head?
Right side.
Okay, how would you describe your pain? It's sharp, stabbing, pressure-like?
Sharp.
Okay, so is this pain radiate somewhere else in your mouth or on your neck?
In forehead.
Okay, and is anything make it better?
No,
Anything make it worse?
no.
So is it worsening or improving?
Worsen.
Okay, do you have still like previous episode of same headache?
No,
Okay, so is it affecting your daily activities?
no.
Okay, if you score your pain from 0 to 10, 10 being the worst, how will score your pain? How will would you score your pain?
5.
I'm really sorry. So can you tell me, Mr. Kareem, is there any loss of vision,
No,
any neck rigidity,
no,
any redness in your eyes,
no,
any nasal secretions?
no,
Okay, or anything like any numbness, weakness in your limbs?
no,
Okay, any recent trauma?
no.
Any skin rash on your head or elsewhere in your body?
Yeah, I have skin changes and rash on my face last month, and my GP gave me medicine for that, and I think I have no rash anymore.
So do you know the condition of that like condition that develop you that rash?
I think he said some infection in my face.
Okay, I'm really sorry to hear that. Can you tell me is there any fever,
No,
night sweats,
no,
lumps and bumps in your body?
no,
Okay, any change in your appetite or weight?
no,
Any chest pain?
no,
Any shortness of breath?
no,
Any change in your bowels?
no,
Any change in your urine?
no,
So, Mr. Kareem, do you have any previous medical illness?
no,
Any previous surgeries?
no,
Okay, any prescribed medication are you taking?
no,
Any allergies?
no,
Any medical condition run in your family?
no.
Okay, Mr. Kareem, I have to ask you some personal questions. So, where are you living
In downtown,
and with whom?
my wife,
And what do you do for your livings?
teacher,
Do you smoke,
no,
drink alcohol,
no,
by any chance using any illicit drugs?
no,
So, do you want to add anything, Mr. Kareem?
no.
So, what's your main concern now?
I'm worried. What is the problem? Do I need head imaging?
I appreciate your concern. According to your data, the most likely problem is you do like as a complication of your rash that you developed last month, and is in the problem is in the nerve that supply on your face, and in medical term we call it trigeminal neuralgia. Is that clear to you?
Okay,
Okay, so what I'm gonna do is I'm going to keep you in observation, check your vital signs, and do a general physical examination, including your head, nerves, and back of your eyes. Are you with me? So, what else am I gonna do is, I'm going to run some blood tests, including hematology, biochemistry, and blood gases, and then, if all turns to be normal, then I'm going to discharge you on painkillers and the special drug for this that we call carbamazepine, and letter to your GP. And if I find anything abnormal in your examination, then unfortunately we have to go for your head imaging. Is that clear for you?
Okay.
Do you have any other further questions?
No, thank you.
Thank you.
Okay, you still have 24 seconds. Okay. Excellent. What do you think, guys? How many marks for Ikra?
7.
10 marks, sir.
10 from me too.
Those are me.
Yes.
Please, I really don't understand how she arrived at trigeminal neuralgia. What are the questions that sum up to that?
Okay. So here regarding accuracy, did she miss any point in general approach in checklist?
No.
Yes.
Like what?
She did not ask what is worsening, improving it.
I did
I
mention.
think when she said
went
about
for,
right side,
She went for Odipara.
No, I
and
did for
even when
You know,
uh,
Socrates or Odibara, if you are not sure or because of stress in the exam, if you ask Odibara, no problem. If you ask Socrates, no problem, because almost the same. Okay, don't worry. So this headache, she asked me which side, but she did not ask
but
me
not
which side.
front or back. Yeah.
Uh, she asked me which side. I said right side. She should ask me which side or which part in the right side. So in the forehead or in the scalp or clear, Ikra?
yes.
Okay. So this point missed. Regarding the onset, already I mentioned and she repeated. So she continued other questions. Maybe she asked same question when I said it's a continuous worsening. She asked, is it worsening? So she should not ask again. Okay. Anything she will repeat, she should not ask again. Okay. Anyway, I think in accuracy, almost all the point covered. So 95% in accuracy. Skillfulness, she's very fluent, but she is rushing. I felt she is rushing in time. She is preparing the question. Once I finish, she is asking the question. Clear, Ikra?
Yes.
So don't show the examiner that you are rushing in questions.
Mm-hmm.
If I answer, so try to wait for at least 1 second. Okay?
Okay.
Don't say what is the side? What is the no, wait. Okay? You are doing very well. So you are very skillful, you are very fluent, but don't rush in time. Support,
Okay.
I think you covered empathy, sympathy, comfortability, check pain, also or giving information in pieces, but rushing in time. And you ask me like one or two questions already I mentioned, it means you are not listening. Okay. You are preparing questions in your mind and you don't care about what I answered already. So supportiveness here, 95% also. Efficiency structure, you are very organized, and safety, you covered the safety points. So the patient has a headache in one side, no problem in the eye or nose, so unlikely to be episodic. I mean, unlikely to be cluster headache. And also the patient doesn't have problem every month or every year or something like that, so unlikely. Um, if the patient has problem in the eye only with trigeminal neuralgia, so this emergency, you have to refer to ophthalmologist now. But if trigeminal neuralgia and no problem in the eye, so you can give him only carbamazepine. Did you mention carbamazepine?
I do. Yes, I do.
Okay. So if the patient has trigeminal neuralgia, this because of infection, most likely viral infection. Okay. So according to your data, it seems like you have problem in the nerve, cranial nerve number 5, which is called in medical term trigeminal nerve. Okay. The diagnosis is called in medical term trigeminal neuralgia. And I need to keep you in observation room. I will do examination, including, so anything relevant to the head, guys, fix this management plan. Anything relevant to the head, fix this in management plan, whatever history or exam. So I will keep you in observation. I will do examination, including your brain, nerves, and the back of your eyes. Again, examination, including the brain, nerves, and the back of your eyes. If I find, of course, and some blood test, including um, inflammatory markers. You said blood gases. Do you need blood gases here?
No.
So don't mention unnecessary workup. Okay, so you can say I will do some blood test, including inflammatory markers. More than enough. Okay, I will check if you have all examination normal and blood test normal. So I will discharge you on printed leaflet, including medicine, which is called in medical term carbamazepine, and refer you to your GP and give discharge letter. If I find any problem in examination in the brain or the nerves or the back of your eyes, I will do head imaging and I will involve which doctor? Neurologist. Okay. So I will give you 8 out of 10 because I want to optimize your management plan and optimize the accuracy and support the also. Clear, Ikra? Okay.
Assalamualaikum, Dr. Hani. Can I ask questions?
Yeah, sure.
Dr. Hani, I haven't finished listening to the concise channel, but I have two questions.
Yeah.
Number one, is it okay during the exam we jot down notes while the patient giving us the input in history taking? That's question number one. And number two,
Again,
what
number
if
one, what is your question?
is it okay during the examination we jot down all the information given by our SP, our patients? I mean,
You
if
mean
there's
you
a
will write
paper,
you will write notes in the exam? You mean that?
if there's a paper on the
No, no,
table.
no, no. They will not give you paper. No.
I see. I see. All right. Thank you. And question number two: what if while we are taking history, but then the differential diagnosis that we got is not the same as what is it? It is during the exam, and our line of management and investigation is different. For instance, in this case, we didn't get trigeminal neuralgia. Instead, we got we say the diagnosis is migraine, for instance.
Okay, I got
Would
your point.
be
Okay.
penalized. Yeah.
I got it.
Thank you, Dr.
Okay. So in such a case, if you don't know the diagnosis, you can get 10 out of 10, yes. Okay. So, for example, I did not get the diagnosis. So, what is your concern? I'm worried. Do I need head imaging? I appreciate your concern. According to your data, you have headache and I don't know the diagnosis. You can check what I will say, guys. According to your data, you have headache in the right side, and you don't have a vision problem, and the pain in the forehead. Okay, refer to the forehead. And for this reason, I will keep you in observation room. I will do examination, including your brain, nerves, and the back of your eyes. And I will do some blood tests, including inflammatory markers. If I find all examination normal, all blood test normal, so I will discharge you with letter to your GP. If I find any problem in the examination, I will do head imaging, okay, and refer you to neurologist. Clear, doctor?
Yes, Dr. Henry, thank you very much.
Yeah. So it's not a problem if you did not reach the diagnosis. Here, the complaint is headache, and this headache relevant to the head, relevant to CNS and the musculoskeletal. So if the patient doesn't have weakness, numbness, and no trauma, no symptoms of CNS like no jerky movements, no loss of consciousness, no vision problem. So you, regarding the history, regarding the symptoms, he's free. So you have to check the examination also. You have to check the signs. You have 2 points: symptoms, signs. Symptoms you will get from history data, from taking data. Okay. Signs you will get from examination. So if history free, you have to confirm that by examination, by signs. If free also, you can discharge the patient, no problem. Even he has trigeminal neuralgia and you discharge the patient, he has no symptoms and he has no signs neurological, no problem. Even you missed the problem, you are doing very well. Okay, don't worry. Okay, next one, Atik.
Yes, sir. Assalamu
How are
alaikum.
you? Alaikum assalam. Okay, next station. You have 30 seconds and then 6 minutes.
Can you start, sir?
You can start.
Good morning. I'm Dr. Atik, ED Registrar. May I know your name and age, please?
I have chest pain, doctor. Wow.
Um, I'm sorry to hear that. I will shift you to a resuscitation room, check your vital signs, check your blood sugar, and attach you to a heart monitor. I will also give you some. Are you allergic to any medication?
No.
I will advise nurse to give you painkiller, morphine.
The nurse gave me morphine already.
Are you comfortable now?
Yeah, it's okay.
Okay. I'm here to collect some data from you. Is that okay for you?
Okay.
Can you tell me more about this chest pain?
The problem started 1 hour ago, on and off, and worsening.
So according to you, the chest pain started 1 hour ago, and it is on and off. Can you tell me where is the pain exactly? It is central or the right side or left side?
Center.
Center. So it started suddenly or gradually?
Sudden.
Is it radiating anywhere else?
Right shoulder.
The right shoulder. Can you tell me about the characteristic of the pain? Is it throbbing, stabbing, or tearing pain?
Sharp.
It is sharp. I'm sorry to hear that. Is it continuous or on and off?
On and off.
Did it happen before?
First time.
Yes, I'm sorry to hear that. Anything that make it worse?
No.
Anything that can improve it?
No.
Can you score the pain for me from 1 to 10, 10 being the worst?
9.
Sorry to hear that. Do you feel any heart racing,
No.
dizziness?
No.
Do you have shortness of breath?
No.
Do you have cough?
No.
You have temperature,
No.
any night sweats,
No.
any lump in your body.
No.
Do you lose weight,
No.
decrease in appetite?
No.
Do you have any skin rash?
No.
Do you have any headache?
No.
Do you lose your consciousness?
No.
Do you have any change in your bowel movement?
No.
Change in color of your urine?
No.
Do you have any past medical history?
No.
Any surgical history?
No.
Are you on any prescribed medication?
No.
Do you have any allergy?
No.
Any disease run in your family?
No.
I'm going to ask some personal questions, which we ask everyone routinely. Where do you live and whom do you live with?
My husband downtown.
Okay, what do you do for a living?
I'm teacher.
Do you smoke,
No.
drink alcohol?
No.
By any chance, do you use illicit drugs?
No.
So, Mr. Kareem, do you have anything to add?
No.
What is your concern?
I'm worried. What is the problem, doctor?
According to the data I have collected from you, the most problem could be your heart. For that, I need to do physical. I will keep you in resuscitation room. Do physical examination. Do heart tracing. Do some blood test like cardiac enzymes. And after that, I will reevaluate you. Is that okay with you? So I have seen the result of your heart tracing. It looked like there is some problem in your heart. There is some blockage in your heart. For that, I need to give you some blood thinners and refer you to cardiologist. Is that okay with you?
Okay, so I will go home or
No, we will keep you in resuscitation room and most probably you will be admitted and we will refer you to cardiologist. Currently, I will give you some blood thinning medications. Then the cardiologist will come and assist you, examine you again.
do I need
Okay.
any imaging or any procedure?
Uh, Most probably you will need procedure, but not currently afterwards, after the evaluation of the cardiologist.
Okay, thank you. Your time done? Okay, excellent. Ati, what do you think, guys? How many marks?
7.
8 marks, sir.
9 marks.
9.
9.
Okay, so regarding this station, the patient has chest pain. Okay, for chest pain, the pain where in the chest, so you should start by cardiovascular and respiratory after, of course, Socrates. Okay, so in accuracy, did he miss any point?
He forgot to ask the patient about his name and age from the beginning.
Now he asked it in the beginning, but then the patient complained that he was in pain. He didn't answer that question.
Okay, so here regarding chest pain, he asked me the first open question, the second open question, and I answered the second open question. He repeated the answer of second open question. I said, pain started 1 hour ago, on and off, and worsening. He did not repeat worsening. He said, according to you, the pain started 1 hour ago and on and off, but he did not say and worsening. So if you want to repeat the answer of the second open question, it should be complete. Clear, Atiq?
Yes, sir.
Okay. Also, despite I said on and off, and despite you repeated that, you ask me later, is it on and off or continuous? Clear?
Yes, sir.
So take care. So please don't repeat questions. If you want to repeat the answer, yes, of course, but don't repeat the question. Okay. So if I said worsening, don't ask me later, is it worsening or improving? If I said on and off, don't say, is it on and off or continuous? Okay. So this insupportiveness, it means you are not listening. You are caring about your questions only. How you care about your questions and you don't care about my answers, how you will get management plan, how you will get diagnosis. The examiner will decrease your marks because you are not listening. Okay. How you will work in the UK and you are not listening to patients, how you will manage patients. Okay. This will make the Royal College not satisfied. Okay, well done. Skillfulness, I think you are very fluent. Even you finished early, but you are not rushing in time. I did not feel that you are rushing in time. So you are very fluent. So here, 100%. In accuracy, 95%. In supportiveness, 95%. Efficiency structure, you are very organized. In safety, you cover the safety points. You moved the patient from the beginning to resus room and you connect it to heart monitor, check vital signs, check blood sugar. Also, I prefer you verbalize, I will do heart tracing for you. In the beginning, yes. Even they will not show you the heart tracing in the beginning, but no problem. At least you verbalized. Clear?
Okay, sir.
Yes. Okay. Regarding the management plan, I'm not happy with the management plan. Okay. Here, the patient you mentioned already, according to your data, um, it seems like heart problem or heart attack. I'm sorry to say that. So you should verbalize that. Okay. Because the patient has pain in the center, pain in the center, and referred to the right shoulder. Okay, on and off, and worsening started 1 hour ago. So typical chest pain. So it seems like heart problem or heart attack until proven otherwise. You should mention that clearly to the actor, clearly to the examiner, clearly to the Royal College. Okay. So I will keep you in a resuscitation room because already you moved him from the beginning. I will keep you in a resuscitation room, and I will connect you to heart. I will keep you connected to heart monitor. Do examination for what? For your chest, heart, and lungs, because maybe the problem, any of them, heart and lungs. I will do some blood test, including heart functions. And what about heart tracing? Is it ready now? Because you already asked about heart tracing in the beginning. So they will show you this one. I find your heart tracing, and I'm sorry, according to your data and your heart tracing, it seems like problem in the heart. So here, according to heart score, guys, how much is the heart score for this patient?
At least 4.
So heart score, HEART, H, the history, is it typical?
Typical
history.
So two
Yes.
points, and then ECG, significant,
SUG is 2.
Significant.
Yes, sir.
2, so 4 now. And then age, is the age is
Less than 45.
less than 45, so 0. If 45
0.
to 65, 1. If more than 65, it will be 2. So this one, 0. So HEAR. Any risk factor in a past medical disease? I denied. So 0.
Yeah.
Okay. Until now, 4.
Troponin.
Troponin, we don't have idea about troponin. So you can tell him like that. According to your data and according to your heart racing, I'm sorry, it seems like heart attack, but your age is less than 45, and this is good. Can you see, Atik, how I'm talking? How I'm communicating with the actor?
So
And but according to your age, you are less than 45, and this is good. According to your risk factors, you don't have any past medical disease, and this is good. And we need to wait for heart function. So you covered heart score by gentle way, okay? Good communication skills. So you covered the H, means the data. You covered the E, means ECG, heart tracing. And you covered the A, the age. You covered the R, risk factor, past medical disease. And the T, troponin. Again, according to your data and according to your heart tracing, I'm sorry, it seems like heart problem. Seems like heart attack. And according to your age, less than 45, and this is good. According to your risk factors, you don't have any past medical disease, and this is good. So we need to wait for heart functions for the test is called troponin, and accordingly we will manage you. If we find you have problem in this test, we will do invasive procedure, which is called the PCI, to check the arteries of your heart, and if it's blocked, we will put a stent. The cardiologist will put a stent. If the troponin, if this heart function normal, we will wait for 3 hours to repeat again. Okay. In the meantime, we will give you now blood thinning medication, which is called aspirin and Plavix, 300 milligram, 300 milligram per mouse. Clear, Atik, now?
yes, sir.
Yes, okay. So this is how to communicate. If they mention communication skills, it means how to communicate, how to ask questions, how to give information, how to pause between questions, how to pause between information, how to give management plan by simple way, okay, according to guidelines. So I will give you 8 marks. Thank you. Safwan?
Assalamu alaikum, sir.
Walaikum salam.
Dr. Hani,
Yes.
any patient with chest pain, I should refer to resuscitation room, or I should keep in observation, doing heart tracing, after that deciding to shift to resuscitation.
Any patient with chest pain, better to be in resuscitation room, okay? Because maybe if you are taking history, maybe the patient will arrest. Clear? Okay. Next one, Safwan.
Yes, sir.
Okay, you have 30 seconds and 6 minutes.
Shall I start, sir?
Not yet. You can start.
Good afternoon. I am Dr. Safwan, one of ED doctor. May I know your name and age, please?
Kareem, 43 years.
Nice to meet you, Mr. Karim. Today, I want to collect some data from you. Is that okay with you?
Okay.
How can I help you today, Mr. Karim?
I have tummy pain, doctor.
I'm sorry to hear that. Okay. Do you have any allergies? So I can offer you some painkillers.
No.
Okay. I will tell my nurse to offer you some painkillers. Are you comfortable now?
Which painkiller, doctor?
I'll I will give you a diclofenac injection. Are you comfortable now?
Okay.
Okay. So, Mr. Karim, can you tell me more about your condition?
Yes, the pain started 30 minutes ago and on and off and worsening. This is the first time for me.
Okay, I'm sorry to hear that. So, according to you, that pain is started suddenly 1 hour back, and it is first time. And am I right?
Yes.
Can you tell me exactly at which side of the abdomen you have pain?
Here in the right flank.
Okay. So it is. Can you describe the pain? It is like a pressure or stabbing. How can you describe?
Sure.
Okay. Does that pain go elsewhere, like to your groin or lower part of the abdomen?
Yes, to the right side groin.
Okay. So it is the pain is worsening with time, as you said. Am I right?
Yes.
Is it continuous or no?
On and off.
Okay. So does anything make the pain worse?
No.
Anything make the pain better?
No.
Any chance can you score the pain from 1 to 10, 10 being the worst? How can you score?
9.
Okay. So, Mr. Karim, do you feel sick?
Yes.
Did you throw up?
Yes, 3 times. Oh. Oh.
Okay. Are you in pain now again?
Yes.
Okay. I will give you another painkiller called paracetamol IV. Are you comfortable now?
It's okay.
Okay. So, Mr. Karim, you told that you throw up. Did you have blood with vomiting? Is there any blood in the
No.
vomitus?
No.
Okay. Is there any discoloration of skin or eyes?
No.
Any change in bowel habits?
No.
Okay. How about your urine? Is there any change in urine?
No.
Okay. Is there any rashes in your body?
No.
Okay. Do you have any fever?
No.
Any night sweats?
No.
Any lump in your body?
No.
Did you lose weight?
No.
Do you have any appetite loss?
No.
Okay. Any problem in your chest?
No.
Any shortness of breathing?
No.
Any headache or jerky movements?
No.
Any weakness in your body?
No.
So, Mr. Karim, is there any past medical diseases?
No.
Have you undergone any surgeries before?
No.
Do you have any? Are you on any prescribed medication?
No.
Okay. So you told that you don't have any allergies. Am I right?
Yes. Oh.
Are you in pain now?
Yes.
Okay. So I will give you another painkiller called morphine injection. Are you comfortable now?
It's okay.
Okay. Great. Do you have any diseases running in your family?
No.
Okay. I want to ask some personal questions from you. Is that okay with you?
Okay.
Where do you live?
Downtown.
With whom do you live?
with my family.
Okay. Do you smoke, Mr. Karim?
No,
Drink alcohol?
no,
By any chance, do you use any illicit drugs?
no. Thank you. Your time done.
Okay.
What do you think is a fun?
I didn't reach the end.
Okay. You are perfect. So in this patient, you started painkiller because the patient has renal colic, or someone told you it's a renal colic.
Yes, I wanted to ask. I want to know why he chose the diclofenac first.
Okay, so this misconduct, okay?
Okay.
So here you should ask the patient first, or at least in the exam, you will find the patient is twisting. The patient is sitting in front of you. If the patient is calm and is not moving, it means he's comfortable. If you find the patient is moving in his chair, right, left, it means he's in pain. So you can tell him, are you comfortable? Do you have any pain? If he said yes, comfortable, done. Because already he said comfortable. You don't give him painkiller, even he's twisting, but he said clearly, I'm comfortable. I have no pain. Okay. But in case he say, yes, I have pain, you should ask him, where is the site of the pain? Can you point at the site of the pain? Clear, Safwan?
Yes, sir.
After that, any allergy? After that, diclofenac sodium. Okay?
Okay, sir.
But don't tell the patient or don't tell the actor. You can say, please, nurse, the patient is holding his right flank. I'm worried about renal colic. Please give diclofenac sodium. How much gram, guys?
100.
75 milligrams.
75 milligram.
It will be
Can give it in 100 ml.
it will be rectal or IM. It's not a big issue. So you can say IM, no worries. Okay. So after that, are you comfortable? Okay, you can proceed. I think you covered almost all the point, but the comment here, you started painkiller before asking about the site. This is the only comment in this area. Okay.
Yes.
I said it's on and off, and you repeated that, and you asked me later, is it on and off or continuous? Okay, so take care. So show the examiner that you are good listener. Okay. I think you covered almost all the points. So here regarding accuracy, did he miss any point, guys?
No.
He missed diagnosis, he missed
Yeah.
management plan, he missed would you like to add anything? Concern. Okay. So skillfulness, he's very fluent. Supportiveness, please don't ask same question again. Okay. So supportiveness here affected. Structure and efficiency. So he's very organized. Safety, he gives the patient 3 times painkiller, and this is safety also. Okay. Because pain is emergency. Pain is emergency. Like chest pain. Okay. If the patient has heart problem, emergency. Also, if the patient has any pain, severe pain, it's emergency. So, because he did not cover all accuracy, I cannot give him more than 6 marks. Clear, Safwan?
Yes, sir.
I'm sure if you cover all the points, you will get 10 marks. But because you did not reach the end of the task, so maximum 6 marks. Okay?
Okay, sir.
Yeah, well done.
Thank you, sir.
Okay, so Safwan, I will give you 1 minute to give me the management plan, the diagnosis and the management plan.
Okay.
Now,
Mr. Karim,
I give you a report, and the report is showing opacity in the right side in the ureter area, okay, And already you have a report written. There is a stone 4 mm, okay, in the right side. Give the management plan, diagnosis and management plan.
Okay, Mr. Karim, according to your data and lab test and scan, I'm sorry to say that you have a stone in your urinary tract. For this, it is 4 millimeter in size, and so I will give you. I will refer to you neurologist for further management, and for the I will refer to them, and I will inform you regarding the management. Is that okay with you?
Okay, thank you. Thank you, Safwan. Okay, so the patient for discharge, guys, or for admission?
For discharge.
Discharge.
Okay, so what are the indications for admission? Number one, if the patient has persistent pain, so you should ask him, are you in pain now? If he said yes, you need to admit him. Clear? Okay. If the patient has no pain anymore, so you can discharge. What else? If the stone more than 5 mm bilateral, so you can admit. If the patient kidney function abnormal or urine analysis has severe infection, so you will admit. Do we have idea about that, Safwan?
No.
No. So how to communicate with any patient, with any actor, with any station regarding the management plan? Give possibilities. So you can tell him, if kidney function normal, urine analysis normal, I will discharge you. And of course, you will fix the general management of discharge, like printed leaflet, discharge letter to your GP, and you can return if any worrying symptoms. Okay. If any problem in the kidney function and or urine analysis, so we will admit you and involve the urologist. Okay. Clear, Safwan, this point?
Yes, sir.
Yes. So how to communicate again for the diagnosis and the management plan? According to your data, it seems like problem in the kidney ureter bladder system. It could be stone or infection, or you can say it could be stone and or infection. Okay. If the patient has severe pain and you give him 3 times painkiller, for sure it's stone. If infection, maybe 1 painkiller more than enough. Okay. So you will tell him, I will keep you in observation room, examine your tummy, and do some blood test, including your kidney functions, and do urine analysis, and do imaging for your kidney ureter bladder system. Here they will show you the report or the scan of CT. Okay, it will be very obvious, and even if you search in Google about CT scan for a stone, it will be clear in Google. So if they show you the image according to your imaging, CT scan for your kidney ureter bladder without contrast, it show a small stone in the right side, whatever according to the station. If they mention 4, mention 4, and so on. Okay, so it's in one side, and this good doesn't need admission, but I will check if you are still in pain. Are you comfortable now? Are you okay? If he said yes, so you can say, according to your pain, you don't need admission at the moment. So we will need to wait for kidney functions and urine analysis. If all normal, so I will discharge you. If any abnormality, I will involve the urologist for admission. I think it's clear now. Okay. Sima?
Yes, Dr. Hani.
Okay. Next station. Here, female, and any female, even headache or any complaint, you should ask about last ministerial period. When to ask last ministerial period in genitourinary. Okay. So in genitourinary, don't forget to ask about last ministerial period and if regular or irregular, I mean normal or abnormal. Okay. So
I need to ask her if sexually active, if I
no.
suspect no.
When to ask about sexual history, if they said here, take sexual history, or they did not mention take sexual history, but her complaint about urethral discharge or dysuria. What else? If not mentioned here, anything, for example, abdomen pain. So if you ask here, any urethral discharge, we said yes. Any ulcer and skin changes in genital areas, she said yes. Here you have to ask about sexual history. Clear now?
Okay.
But if not mentioned, take sexual history. If not mentioned, you can blame dysuria or urethral discharge. If you ask her about genital symptoms and she denied, don't ask about sexual history at all. Easy?
Yes, okay. Thank you.
Okay. You have 30 seconds and 6 minutes. You can start.
Hi, I'm Dr. Sima Eid, registrar. May I confirm your name and date of birth, please?
Karima, 43.
Nice to meet you, Karima. How can I help you today?
I have tummy pain.
Sorry to hear about that. Are you comfortable right now?
Yeah, it's okay.
Do you have a pain so I can offer for you a painkiller?
No, I'm okay.
Okay, so I need to take more questions about your pain. That's fine with you?
Yeah.
Please, so can you tell me more about your abdominal pain?
Yes, the pain in the upper side of right side of my tummy, and it started 3 days ago. The pain is continuous and worsening.
Okay, so you have a pain in your tummy, upper right side. 3 days ago it started. It's continuous and worsening. Is that right?
Yes.
Okay, so please can you point the side of the pain for me? Where exactly?
Yes, in the right side, in the upper part.
Okay, so can you describe the pain for me? This is like a pressure or stabbing?
Like sharp.
Okay, does the pain goes anywhere?
Yeah, to right shoulder.
Okay, did you have the same problem before?
No,
Okay, so did you feel sick?
no.
Throw up?
Yeah, I threw up 4 times.
Sorry for to hear that. Any blood? Your throw up? You notice? Any blood you notice?
No, no.
Okay, that's fine. So, any change in your bowel
No,
movement? Okay. Any change in your urine?
no.
No pain when you are passing urine. Okay.
Mm.
Okay. So, did you have any discoloration of your skin or your eyes?
No,
Do you feel any heart pain?
no,
Okay. Anything make the pain better?
no.
Anything make it worse?
Yeah, if I'm eating fatty food, something like that.
Sorry to hear that. So, can you score the pain for me, please? From 1 to 10, that 10 is the worst one.
Like 9.
9. Okay. Sorry for that. So do you have any chest pain or heart racing?
No,
Do you feel dizzy?
no,
Any shortness of breath or cough?
no,
Okay, that's fine. So do you have any lump in your body?
no,
Okay, so do you have high temperature?
no,
Skin rashes?
no.
What about your appetite and weight?
It's okay.
Okay, it's fine. Do you have any past medical history?
No,
Okay, did you underwent any surgery before?
no.
Okay, Miss Krima, where do you live and with whom?
My family in downtown.
Okay, did you smoke or drink alcohol? Did you smoke?
No,
Drink alcohol?
no,
By any chance you are taking any illicit drug?
no.
What do you do for a living?
I'm teacher.
Okay. You are taking any medication?
No,
You have any allergies?
no,
That's fine. Any disease run in your family?
no.
Mr. Karima, can I know what's your concern?
What is the problem, doctor? Do I need any imaging in admission?
Okay, I appreciate that, Mr. Karima. According to data, what I get it from you, you have tummy pain and you vomit and you throw up many times. So I need to give you an observation room. I need to do general physical examination. I will examine your tummy, and I need to run some blood tested, include full blood count, inflammatory marker, and function for your liver. And you may need imaging. So at the pain related to your fatty meal, so you may have a stone with a stone in your gallbladder, which is the organ beside your liver in your tummy. So we need to rule out that. We will make a scan for your tummy. Okay, is that fine?
Okay.
And if everything is normal, if your liver function is normal, so we can discharge you. If you find any abnormality in the examination or in the lab test, so we need to keep here. Also, I will make a urine diagnostic test, and we will do a urine analysis. Okay.
Okay.
Okay. So also we need to rule out the pregnancy test. We may need to do pregnancy test for you. Sorry, I forgot to ask you about last menstrual period.
Yeah, it was 3 days ago.
Okay, that's fine. So as I tell you, we need to rule out the stone in your gallbladder. Okay.
Okay.
Do you want to ask any? Do you want to add anything?
Thank you. Your turn.
Thank you.
Okay. Well done, Sima. What do you think, guys? How many marks for Sima?
8.
Yeah,
Nine.
7 to 8, sir.
7.
Okay. The patient has tummy pain in the right side upper part. Okay. So it could be something relevant to the gallbladder, or the liver. Okay. So here the patient has continuous pain or on and off?
It's
On and off.
continue.
Continuous. So we
Continue.
can think about acute cholecystitis or ascending cholangitis. Okay, because the pain is continuous. If the patient has no jaundice, I denied, so acute cholecystitis, right? It means inflammation, infection in the gallbladder. Okay, and this patient needs painkiller antibiotic discharge, but only if the liver functions normal. Okay, you cannot discharge until you find the ultrasound scan normal and the liver function normal. Otherwise, you have to involve the medical team. Okay. Sometimes, if the problem relevant to endocrinologist, no need to mention endocrinologist. I'm talking in general, not this station. For example, the patient has thyroid gland problem or anything. You can just mention the medical team, more than enough. Okay. Also, this station, if the patient has problem in the gallbladder, if you want to mention the medical team, okay. Okay. If you want to mention the surgery team also, okay. So here, regarding this station, if you find the jaundice, it could be infection, inflammation in the gallbladder, okay? It could be infection in the liver. So you can give the diagnosis and fix the general